Countdown here, and it is August 4th, 2020. We're going to be doing a lumbar Deuk laser disc repair on a patient who presents to us with back pain and right-sided leg pain. Now he's got some herniated discs in his back, 3 of them, but really one of them is the worst. The other 2 are not quite as bad on the MRI, but they do have abnormalities with tear, small herniation. This is Dr. Deukmedjian. Are you comfortable? Shoulders hurting him? Why is his shoulder hurting? You have a shoulder problem? Interesting. Anything we do to make it more comfortable? We've lowered the arm board all the way down. Yeah, I would lower the arm board as much as possible. All right, this is my hand. We're going to get started. I'm going to give you some numbing medicine, okay? And then we're going to get started. You're going to feel a little stick and burn. Anything you can do, Dr. Arcos, to make him more comfortable. I cannot give him general yet. I can only give him local. But patients don't like the needle going in, so they jump around. I got to deal with this with every anesthesiologist, unfortunately. I want him awake and alert, but I want some kind of calming, helpful medication right now while I'm getting there. So if you ever want to, I don't know, you're going to be working with for a while, I suppose. There's a Dr. Santiago who the patients never had any pain when I was doing this. Yeah. So I would look at his operative records, see what he's doing. But yeah, he shouldn't be in this much pain. Shut. I don't want anything at all. So it has to be something quick, fast acting, wears out quickly. Lateral. Certainly not propofol, but I don't know, maybe it could be. Alright, so for lumbars, you always have to have the table where it's ready to go in the lateral. You don't have to ask the anesthesiologist to do that. Do you understand what I'm saying? Should be good. Shot. It's probably better because I'm not doing anything. Huh? Yeah, good. Shot. 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 You're doing great. I'll let you know if there's any problem. Shot. Shot. AP. Yeah, everything's okay. You're fine. So what I'm going to do is place 3 needles, and that's going to take me about 15 minutes most likely. Lateral, and keep the AP on the right board. Alright, so if anything, I'm more medial than I want to be. Shot. You're doing great. Try not to move. Shot. 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 And this is kind of where I just need him awake, this part. Shot. You're doing great. We're going to be able to put you to sleep soon, but just not yet. Right against his iliac crest. Yeah. Shot. What's that? Shot. Just relax. You're doing great. Shot. Try not to move. Yeah, keep your head down. Is he saying anything I need to know about? Uh-huh. Just lay still. Shot. It's too high. Shot. Numbing medicine. Give me the needle back. How's our blood pressure? Good? I don't know if you can get it down just a little bit. You're doing great. Just try to relax, Shot. Let us get this done. We'll have you out of here as soon as we can, okay? Shot. You're pulsing, right? Shot. Why am I having so much? Shot. Shot. What's he saying? Shot. Huh? Oh. Thank you. Shot. All right, AP. Where do you live now? You used to practice in this area, right?
Oh, yeah.
With Gales, Golovac? Both of them or just Golovac?
No, both.
Both?
Practice, yeah. Down in Palm Beach, we practice there.
Lateral. So you had practice in both places, south and here at the same time, or just here?
No, I was here and then down in Palm Beach.
How long were you in Brevard County for?
3 years.
Where were you before that? Are you comfortable, sir?
Made him, yep, so far, so.
Shot.
University of Florida.
What, residency or
No, I was a program director.
for what?
Anesthesia, pain.
Oh, really? What years were you the program director?
90s.
Because that's when I was there in the mid-90s.
Yep. At Gravenstein, I was the chairman.
Yeah.
Comfortable, my friend?
Yeah, that's good. Yeah, Dee Dee Grabenstein, Mike Mela,
Oh, yeah.
Sherry what was her name? Sulik. You ever work at the VA there?
Oh, yeah, absolutely. They sent me over there to start that pain program up over there.
Oh, yeah?
Oh, yeah. We took it from a closet to 40,000 square feet.
Shot? Took what?
The VA pain program. It was embarrassing. It was literally the size of the closet. I went over there and Kirby said, fix it.
Kirby. Fix it. Come on, please. They didn't give you the resources to fix it.
It was my luck that Kirby remembered me from the military, so I was like, oh my God, he follows me.
Shot?
Feeling that, huh? A little bit?
Those guys never really wanted to fix the program. The VA system shot works as do as little as you can for the vets. Is that it? Unfortunately, shot. They got caught with their pants down. I remember as a neurosurgery resident in the VA system, I was trying to, we had such a backlog of patients, I was trying to get them to come in and be seen. And they wouldn't let me expand the clinic. We would only let us see 5 patients in the morning and 5 in the afternoon. I said, we got a backlog of like hundreds of people. I want to see more. And they said, nope, can't do it. I'm like, what do you mean you can't do it? Makes no sense. Where do you feel that? Is it going down your leg or not? All right. Where do you feel that? In your back or down your leg? All right, that's your bad, really bad disc. I know, settle down. That's the worst one. That's the 4-5. I have a feeling that that one's definitely going to be a bad one. Almost done. We're going to put you to sleep soon, okay? Just relax. I'm not ready to put you to sleep yet, but everything's going well. You're getting there. We're almost done. Relax. Shot. Who? Oh, yeah. Pat Jacob. What a nutcase. Can't stand Pat Jacob. He almost got retired by a few of the patients of the VA. You remember that when they came with the gun? I tell these guys about how the police were running everywhere, and I said, what's going on? They said, we have an active shooter in the hospital. I said, who are they trying to shoot? Pat Jacob. Twice. Were you there for both times?
No, I was there for one time.
Yeah, but in 2003, they...
A 19-year-old with an intradural tumor, I sent it to Jacobs. He called me up in the OR. He said, you know,
Relax. You're doing great.
I grabbed that tumor and it unwound itself from the cord, came out in one piece.
Yeah, right. I saw him kill people. I mean, literally, his just didn't even care. It's a horrible shot. And Roper, the exact opposite of Jacob. Roper would take tumors out, one cell at a time. I remember we did an 18-hour acoustic neuroma. You're doing great. We're almost done. Shot. I'm right on his facet. Yeah, I'm right on. You can see I'm on the facet at 3-4. So if anything, it's facet pain. He's got a lot of inflammation in that facet joint. Shot. All right, so we're there. AP, you just relax. We're almost done. You're doing fantastic. There's nothing wrong. Everything's going well. I apologize that it's uncomfortable for you. Yeah, it's a necessary evil, but I'm almost done, I promise. Go back to the lateral. You're doing fantastic, though, I promise. I need your help for about 5 more minutes, and then I'm going to put you to sleep. The anesthesiologist will put you to sleep, okay? So I need your help for just a few more minutes. All right, just relax, just relax. You're doing great. Let me know when things ease up and get better. Let me know when you're comfortable, okay? Is that better?
More comfortable now? No pain.
Perfect, perfect. Where do you feel? Is that your typical pain? Is that your typical pain? Is that where you typically get pain? How bad on a scale of 1 to 10? 10 being the worst pain of your life. 10. Wow, 5-1 is a 10 out of 10. I mean, you can see the tear, the annular tear, so it's not terribly surprising. All right, so not L5S1 is a 10 over 10 concordant. Let me have a... What's that? A 12? Wow. Well, I hate to see what the next one's going to be. Wait, yeah, that was 5-1 for sure. No, be careful. Don't reach for these needles, okay? Yeah.
Where's that? Oh,
How bad is that on a scale of 1 to 10?
15.
15. That was your worst one. That's the 4-5. Big tear.
Feel that in the back?
All right. Is that where you typically get your pain?
Yeah.
I apologize. We got one more to go, and then we're going to put you to sleep. Did you come here by yourself? Who?
Mom and Dad.
Oh, okay. That's fine. You're from Michigan, right? Okay.
Laser spine.
Well, we do better than laser spine here. They don't know how to do what I do. Are you feeling more comfortable?
It's still a little bit hurt. Yeah, that hurt.
Is that on a scale of 1 to 10? What is that?
A 9.
Okay. Same. Is that your typical pain?
Go back again, same place?
All right, we can put him to sleep.
All right. Good news, huh?
When you wake up, we'll be all finished. Everything's going really good. Just lay still. Well, he's got small tears at 3-4 and 5-1, a much bigger tear at 4-5, but all 3 discs are concordant pain. So I feel the need to treat all 3.
I want you to tell me if you start to feel this medicine.
Count from 1 to 100 out loud, please. Count out loud from 1 to 100. Shot. Keep going till you hit 100. Shot. Shot. You're doing good. Keep counting. Nice and loud. Oh, you're fine. Everything's okay. Shot. Amazing, huh? How painful those discs are? Keep counting. You're doing real good. So just take your time. Get them down where you need them. If we can get the blood pressure down, that'd be much better. And I can wait if you want me to wait. It's not a problem. Let me know when I can proceed. So the good news is it should be relatively quick at 3-4 and 5-1. Huh? The most painful part is when I hit the annulus with this tip of this thing. That's what's going to bug them the most. Shot. You can see we're just going past the facet joint. Shot, entering the foramen. How did the rhizotomy go for his neck? Good? All right. Yeah, he's nice. He's not responding at all. So whatever you're doing is nice. But, you know, keep him safe. Shot. All right, so there's a small tear in the disc, and we're going right through that tear because that's what we're there to repair. Shot. We're going to repair this tear. Sounds a little cheesy, repair the tear, but that's what the Deuk laser disc repair is. So rather, you guys saw the last case, for those of you that watched it, it was a major surgery, big incision, really long surgery, very painful to recover from, weeks and weeks of recovery with painkillers, narcotics. By the way, that patient's doing great. Shot? Uh-huh. So, interesting. You saw that dilator popped out. A lot of pressure inside the disc. Intradiscal pressure. Damn. Shot? Just wants to keep popping out. You see that? So, I need something to hold it in with. Shot? Not common. Damn. Shot? No. Let me have a... What else do you have available? Let me something long that I can put in there. You have another dilator? Shot. Ah, see, it keeps coming out. Shot. I need it to stay. Shot. I need another dilator. Shot. So his disc has so much inflammation going on that the pressure inside the disc is so high that it's literally pushing this dilator out. Now I've seen it come out a little bit before. I've never seen it come out this much. This is insane. I can't advance the tube over it unless I have a dilator in place. Come on, Luis, I need a dilator wherever you are. Like yesterday. If you have to scrub out and get it, go do that. Shot. Shot. All right, I think we got in there pretty good. I think we're okay now. Shot. That's it? All right, that's good.
At least we're done.
Let's go. Where's my suction tube? Okay. You got to have all this straightened out before we get started. Otherwise, we have to fool around. The flow does not stay there. Shot. You got to move it up and out. Let's go with the scope. Scope on. Yeah, you got to go up and out. Oblique and out. All right, let's get this scope on. You already white balanced it? Okay. Scope on. Get that laser ready. The light is not on. The light is not on. We need the light. The scope's working. The light's not on. Guys. Is there another one, Luis? It has nothing to do with white balancing. It has to do with power. Power or bulb. That is not the camera that's the problem. It's the box below the camera. It's the light box. You guys push the power button? How about the standby light? Did you push that? Did you push it in? Okay. And the one below you pushed? And did you turn the power switch in the back on? And did you check the plug to make sure it's plugged in?
Yes, sir, that's what I'm on back here.
There's a little switch in the back that should be on and off, right? Did you guys turn it on? So take the blue cable out. Take the blue cable out. Guys, the fiber optic cable in the front of the box needs to come out. Don't drop that, Luis, whatever you do. There we go. All right, so that's clearly working. So take the blue cable out. Louise, yeah, take it out and replace the unit. Let go of the blue cable, let it come down. Take the other one out of the slot. Yeah, we're going to switch them out. Yeah, that's what we have to do. Do it the right way. So Louise, I would check the bulb first. See if it's a bulb issue, and basically take a new bulb that you know works, or take the one out of that works and put it in there, see if it's a bulb. And if it's not the bulb, then it's got to be a problem with the unit itself. All right. All right. Laser, you're doing fine. Everything's okay. You're doing great. I need my laser on. We're going to be on at 30, correct? All right, so the blue stuff is the disc, the herniation. And what I told you before was that this disc is under a lot of pressure. So we're going to be removing some of the inflamed disc material. That'll bring some of the pressure down. You're doing great. Everything's okay. I would try to titrate him and maybe get his blood pressure down a little bit. So the blue cable or fiber is the laser fiber, and what you're seeing is there's the tear right there. That blue tear. That's the annular tear. That's what this procedure does. It repairs that. The white stuff is the annulus fibrosus. The blue is the degenerating nucleus pulposus. The blue is a stain that we put in with the discogram. And what it does is it stains the degenerating herniation. Once a herniated disc starts coming out, once the jelly in the center starts coming out, it starts to get acted on by the body through inflammation. And that causes it to degenerate. That's why it stains blue. Makes it easier for me to see. That's why we do the blue dye. Of course, blue is the color of Deuk Spine Institute. All of our laser patients go home with a little more Deuk Spine Institute regalia. All right. Just about done with this one. Remember, this disc did not have a big tear. but it was painful, and the painful area is what I'm working on right now. So are you still doing pain management?
Oh, yeah.
Just down south or what?
Yeah, actually got top pain out in Palm Beach award last.
Who's that?
That's the day, you know,
They awarded you?
yeah,
Congratulations.
yeah, it was just nice.
Well, you know, if you want to,
For your peers, so it means more.
that's awesome. Yeah. If you're interested, you're welcome to bring some cases here and be part of this facility.
Hey, how you doing there, buddy?
Do you have many patients from up here?
Yeah, we actually have quite a few.
And are you guys all anesthesiologists?
Yeah, all anesthesia.
All anesthesia and anesthesia pain medicine. Nice.
Oh, yeah, you felt that one a little bit?
Yeah, we're in one of your bad discs. That's why you're having so much pain. We're going to be done in just a moment. Everything okay? Everything okay? Can you hear me? You think he's comfortable enough? All right. Yeah, I mean, he doesn't seem to be responding, so as long as he's happy, I'm happy. Laser off. Any thoughts, Luis? Any thoughts?
I'm gonna have somebody right now check it out for me. What do you need?
That suction is slow. Scope off. One down, two more to go. You're fine. I apologize. Give me a rolled up blue towel. You've got to have a rolled up blue towel ready. Come on, Sam. Luis, you got to have Sam have a rolled up blue towel ready. We use it every single time. It's a half roll. It's too big. You're fine. Everything's okay. You're doing great. Anyway, we can make him a little more comfortable. You have the propofol, the infuser, right? You're doing fine. All right, Sean. Take. That's a great question. So is there any risk of weakening or disrupting the annular tear further by doing this procedure? Remember, the problem is the annular tear is not healing. You need the laser fluoro in. So it's already disrupted in such a way that it can't even heal itself. So it's completely compromised. And what I'm doing is I'm debriding it, getting rid of all the herniation that's sticking out through it. I'm getting rid of the the edges of the annular tear that aren't able to heal. Come on, lateral, it's lateral, it's lateral. So what we're doing, although it looks quote unquote barbaric, it's actually allowing the disc to heal properly. Hence repair itself. So I'm helping the disc to heal itself, basically through what I'm doing. If you're familiar with surgery, you know that there are situations where the body's tissues cannot heal itself. Have you taken a shot? So for example, one of the best examples is a decubitus ulcer, where there's a lot of devitalized tissue. All right, so what you need to do is, we're going to go for 4-5, I believe, next. So you want to center that, which is pretty good. It's looking actually pretty good. I would just try to zoom in a little bit on it. So basically, with a decubitus ulcer, you have all this dead tissue and an ulcer, a crater that goes to the inside of the body, and it's really bad. You want that thing to heal up. So what we do is we go in there and we surgically debride the edges of that wound that are not healing. We clean it up, get rid of all the bad stuff in the center, the necrotic debris, and then we put a suction drain on it usually, and it sucks the edges closer together, and that allows the wound to heal. So those wounds won't heal themselves. And going in and cutting the edges and debriding it makes it looks barbaric and gruesome, but it actually the only way it's going to heal. So that's what I'm doing for this disc. The disc has been injured. Shot. Are you okay? Yeah, he should be a little more asleep. So the disc has been trying to heal where the tear is at the back of the disc, but it hasn't been able to. And all that trying is through inflammation. And it's the inflammation that's causing the back pain. So it's the inflammation in the tear that causes back pain and neck pain if it happens in the neck. Let me know when I can proceed. So what the Deuk laser disc repair does, it's the only surgery in the world that repairs the annular tear. And we published that back in 2012. So that was 8 years ago. I've been doing the surgery for about 13 years. But I didn't publish the results until, I was certain that it was actually working. And we had proof of it. So once we were sure of it, we collected all the data and analyzed it. Let me know when I can proceed. And that's when we published the outcomes in 2012 and 2013. Just relax, you're doing great. Let me know when I can move forward. Want me to wait a little bit? All right, do you have another one of these? Where is it? Sam, you're killing me, man. I told you the right way to do it, and you're still standing there doing nothing. No, look at this right here. All you got to do is roll this up. It takes 5 seconds to do. Okay? Come on, Sam. Sean, any other questions from our audience? Sam, you got to push yourself a little harder. I'm not going to succeed if you don't try harder. If I approached my problems in life that way, I would never have been successful at what I do. All right, thank you. Yeah, we have a little difficulty with our audio part of our system, and so I can't really hear Sean unless he calls into the operating room. Sean? All right, so the tip of the dilator is getting a little bit hung up at the facet joint, and I'm going to go ahead and try to continue to advance it. Shot. We'll get past the facet. That's it. I need to angle down a little bit. Shot? Yeah. Let's get an AP. All right. So, back to a lateral. I want to try to get the dilator a little bit lower, but I want to get this guide wire out first. Take this. Shot. Let me have the mallet. Shot. Yep. I know. This is your worst one. So I'm talking to our patient. I don't know, what his level of awareness is, but if he's awake, I want to make sure that he's, he knows everything's okay. It's just a little discomfort. Shot. All right. Now he does have short pedicles, but that's not what we're here to fix today. Shot. You're doing great. I know this is the worst one. Shot. All right, good. So now it's advancing the dilator with it, which we don't want to do. We want to get that out. We're done with it. And the reason that happens is sometimes a little piece of tissue gets trapped, shot, between the dilator and the tube. Let's try that. Is it wet? If it's not wet, it won't do anything. Sam, you got to learn the nuances, son. You got to pay attention to the details. Shot. If you're not paying attention to the details, you're not going to get any good at what you do. We're not going to tell you the details. You got to start paying attention to the detail. You're learning it yourself. We don't have time to be teaching you all the details. You got to learn through observation. Can you imagine if they taught me neurosurgery by actually teaching me all the little details? You know why they pick the smartest doctors in the world to be neurosurgeons? Because they don't have time to teach you all the details. Where's the scope? It's not on. Come on. They want you to be watching and learning yourself. That's why they select the smartest doctors. There's a lot to learn, but they want you to learn through observation, not spoon feeding. Luis, what's up here? Am I missing something here? Is this the right grabber? Huh? It's not going in. I don't think this is the right grabber. Come on. Sweet Jesus. Let me have the, no. Let me have the laser. Luis, you got to figure that out, man.
Yes, sir.
I need the laser on. This is the annular tear, by the way, the white thing. That's all scar tissue. Do you have a grabber?
We have a grabber.
Let's see it. Standby laser.
Standby laser.
This is not going in, Luis. You're not the only one, my friend. Because I think it's the right one, isn't it?
Yeah. That's the one that we use.
It's not. No, it's not. This may be a different scope, an older scope.
No, that's the one that we sent it to repair.
Yeah, whatever, the bore on the inside is too narrow. It's not the, I don't,
You want like a cervical one? It's not gonna
you have another grabber, a different one, or is that it?
cervical.
All right, let me have it.
Yeah.
No, let me have the grabber.
Yeah.
Take it. Laser on. Sam, you gotta let it go. You don't you know? Luis has already told you. You have to let the wire move. You can't hold it. Grabber. Is that the same one?
It's the same one, sir.
Here, Sam. Try to use the same one. A lot of scar tissue right here. That thick stuff. Sean, any more questions? If there are, just call in. If not, I'll assume they're not. So we're inside a herniated disc right now, repairing it with a laser and an endoscope. There's no one else in the country really that does this type of surgery, and very few doctors in the world know how to do it. We make it look somewhat easy, but don't be deceived. If it's not done properly, people can actually get seriously hurt, so it has to be done properly. I've done thousands of disc repairs now at this point, and I know exactly what needs to be done to do it right, to not harm the patient first, of course, foremost. We've been very fortunate in 13 years of doing these procedures, 0 complications to date. Yeah, I'm happy with it. 115. It's a little on the higher.
That's a pretty uncontrolled hypertension.
He does?
Oh, yeah.
Where does he live normally?
Michigan,
No, where does his blood pressure live?
60 over 100.
All right. We're going to keep him nice and safe. All right, this is our second disc that we're fixing. The first one we already did was L3-4, and this is now L4-5. This is the worst one. If you look at the discogram, it's the worst one. Has the biggest tear. If you look at the MRI, it's the worst one. It has the biggest herniation and the biggest tear. I was actually surprised, to be honest with you, that the bottom one, the L5S1, was painful. because when you look at the MRI, it doesn't look bad at all. But people wonder why, well, why does back surgery not work? Well, sometimes it's because the wrong technique was used, but sometimes it's because not all the painful discs were treated. This would be a perfect example. Not many surgeons would treat L5S1 because on the MRI it doesn't look so bad. So the mistake surgeons make is they treat MRIs, they don't treat the patient. The truth is that the L5S1 disc is painful, but you can never tell based on the MRI. My intention was to come in and test it because there is a herniation at L5. Your flow is not right. It's supposed to be not blocking my knee, and you should be pulling it out far enough it's not hitting me.
Why are we pulling the TV as well?
Huh? Why what?
No, the tower was moving as well with the floor.
I don't know. I can't watch over everyone's shoulder. I expect people to have a certain level of competence at doing what they're doing. It's okay. All right. So what I was getting at is it's really an art to being able to cure back pain. And it really has to do with understanding all the causes that are potential causes and making sure that you're treating as many of those causes as possible. Otherwise, the patient's still going to have back pain. If the patient has 4 different causes of back pain, you fix 3, they're still going to have back pain from the 4th cause. So you have to know all the causes of a patient's back pain, and that takes a lot of skill and experience. Sometimes it takes certain tools or tests, but it's not one thing that tells you. You got to use the physical exam. That's probably the most important tool. The MRI is a very important tool. But you can't use the MRI by itself. You have to correlate the MRI findings to the physical exam. And that's what's hard for most doctors to do. So the physical exam will tell me about causes of pain that you won't see on an MRI. So there are about 30 causes of pain for lower back pain. And some are more common than others. The most common are probably the facet joints, and those aren't going to be seen on an MRI, where the MRI will tell you that's the cause of the pain. That's a clinical diagnosis, and then you do a diagnostic block of the facet joint through interventional procedure, and that will give you the diagnosis. So if your doctor that you're treating with doesn't know how to do a medial branch block, they're not going to be able to diagnose facet pain. If they can't send you out to a doctor that does a medial branch block, this is all scar tissue, by the way, all this thick greenish yellow stuff. This is from inflammation, chronic inflammation. Did we figure out about the grabber?
I just grabbed one cervical. Obviously,
It's not long enough. I need the other one. But you got to figure out why it's not going through here.
yes, sir.
Laser. You're doing fine. Everything's good. I know this is the most painful part of your back right here. We're almost done fixing it. Yeah, don't move around at all. You're doing great. Just lay still. We're almost done. We'll get you back to sleep. Yeah. Yep. That's your bad disc. Been working on it for a while now. This is all part of the herniation. So we just freed it up. Hopefully it'll make its way out. This is a huge annular tear right here. You see that? We got about 15 minutes left. So about 5 minutes on this disc, 10 minutes on the last one. Oof. Yeah. It's all scarred up. Those fibers there, right where I'm lasering, you can kind of see they're running left to right. Those fibers are called the posterior longitudinal ligament. What's the issue, guys?
Sony says the bulb died on
The bulb died?
Yes, sir.
Oh, okay. But I thought it had a life. Doesn't it tell you how much life the bulb has? Like right there, see how it says 50%?
Yeah.
No? Not reliable? Premature death?
What's what did you say? Price?
Only $600 for a light bulb? That's a steal.
I need to check because I have that here.
Yeah.
They'll need to,
How many people think a light bulb should be $600? Raise your hand. You wonder why medicine costs so much, why the hospitals charge you, 20 bucks for an Advil. It's because the light bulb that we have to buy for our machine is 600 bucks. And that's, by the way, that's probably like a discount price because normally it's $1,000 bucks. $1,000 for a tiny little light bulb. Now, folks, everyone wants to complain, oh, medicine, hospitals charge too much money. So how are we going to pay for that $600 light bulb if we don't charge you 20 bucks for an Advil? Right, Dr. Arcos? Huh? People just get upset. Oh my God, you're charging me too much. Well, who's going to pay for the light bulb? Who's going to pay $600 for the light bulb for us? Should I charge this patient for the light bulb? Is that fair to this patient? Because it blew out during his surgery? No, because we've used it for a few other people. See, that's something a lot of people don't understand. You have to actually split the cost of healthcare because there's more than one person benefiting from it. You've got to share it across multiple people. Now, if we just used medicine just for this one patient, then of course we would charge just this one patient. But there are supplies and equipment we use that they're used across multiple patients. So I can't charge this one patient for the light bulb. I got to charge 100 people for that light bulb. And that's why the Advil costs so much. Since there's no questions, I figured I'll just teach you guys a little bit about something called cost shifting, which is part of the economics of healthcare. If you want to get angry with anybody about a $25 Advil, get angry with your insurance company for not paying for you. They're the ones who should be covering that cost. Since we're on the subject of costs and nobody's asking me questions, I'll just talk about it. United Healthcare is an insurance company in the United States, one of the larger ones. They just posted their profits for the last 3 months. Anybody know what they were? Profit. 3 months. Huh? $10 billion, that's correct. $10 billion for 3 months worth of work. $10 billion in profit. I didn't say million, I said billion. So they're making $10 billion in profit at the same time they're denying you guys paying for your medical bills and paying for your $25 Advil at the hospital. That should make you angry. You want to get angry at anybody, don't get angry at the hospitals for cost shifting. Get angry at your insurance companies like Blue Cross, United Healthcare for not paying your bills, denying your surgeries, denying your treatment. All right, just about done here. Just cleaning up the last few millimeters.
Wasn't that long ago, Blue Cross was the first company to have $1 billion profit before?
Yeah. Oh, these companies, oh, by the way, the $10 billion that United Healthcare Group has reported for 3 months, that's just what they're reporting. That doesn't even include the hundreds of billions of money that they actually move overseas and launder in foreign countries so that the stockholders don't get a piece of that. Yeah. Meanwhile, doctors are struggling to make their overhead. Hospitals are closing down because they can't afford to stay in business anymore.
And they reduced the conversion factor to 20
Yeah, they keep reducing our conversion factors, which if you want to know what that means, it's what they pay doctors basically. Anyway, we're done here. Sure. Thank you. Looking good. Maybe just a little more of that. Laser off. Nice. Scope is off. Is that correct? Dilator. So are we going to figure out what's going on with the scope? Is it the I think it's the scope. It's got to be the scope.
Yeah, I need to check. I send it back if
No, I think so. It may be a different model scope. You understand? Oh, okay. I see what you're saying.
back to them and then
Interesting. I think it's worth getting one of the other scopes out and just seeing, because those are the grabbers that are supposed to be able to go down, right?
yeah.
So it's a bit unusual, wouldn't you agree? Let's bring this fluoro in.
What's your demo?
We're good. Just don't hit the scope. Yeah, we want a lateral. We don't do AP at this point. We got one more to go. I'll try this one and we'll be done. Let's get that guide wire. Okay, when it comes back a little bent like that, you got to straighten it out. You understand? You should inspect it as soon as I give it back to you. You see it bent, you need to straighten it out. Luis will show you how to straighten it out. How's he doing?
Snoring.
Let's get that lateral at 5-1. That's where we need you. Too high. Shot. That's good. Just stay right there. Shot. All right. Shot. Looking good. So all this with a 7mm incision. Shot. Okay, almost done. Just lay still. You're doing great. Shot. All right, whatever we can do to help him. You ever use, huh? Oh, fentanyl? No, but there's, what's that drug? The horse, the one they give the animals? You know what I'm talking about? Ketamine. He did? Shot. I mean, this should be the end of the painful stuff. Hey, as long as he's amnestic to it, I'm happy. I had one anesthesiologist who shot. I had one anesthesiologist come who the patients told me afterwards, all three, they said, yeah, I was awake for the whole surgery. I remember everything. It hurt so bad. So that's not supposed to happen. All right, for those of you watching this surgery, we don't edit these surgeries. These are live, and we broadcast them because we want the audience to be part of the surgery. We want you guys to become experts in what the real world is like in spine care. So we're not trying to hide anything from you, Sean. We want you to see and hear everything we do. Sean? You're doing fine. Just relax. You're doing great. Shot. All right. So it's pinching the dilator again. Mm-hmm. Yeah, I need that. Shot. That's where we are. Good. Let me have it. Ah, damn. Shot. Okay. Huh? Great. It's stuck. Shot. No, it's not. The problem is it's not that it won't come out. It will come out, but it's taken the tube with it. You know, it's taken the tubular retractor with it. That's the problem. So I need something to grab the tubular retractor. A coker won't work. Yeah, the coker is just letting it slip. You have a vice grip? God damn it. Thanks. This is a bad vice grip. Let me have another towel here. Is it wet? Go ahead, get a wet one in there. Shot. The problem with the vice grip is it's graduated. It's narrow at the tip and then it keeps getting bigger towards the back. Stupid thing. I mean, I don't know when we got this little vice grip. There we go. Shot. Shot. All right. Seems like we're making some progress now. Shot. All right, well, let's advance this just a little bit. Yeah, good thinking, Luis. Hopefully we won't trap it again. Shot. Yeah, I got to bring this forward a little bit. Shot. Shot. All right, that's good. I think we did it finally. One more shot and out. Go ahead and bring it out. Once again, small tear at L5S1, but painful. Up, out. Yeah. I don't think we'll need you anymore. Thank you. Fucking damn it. All right. Grab her. Get your right there, Sam. Is there anything there? Did I get anything?
Yeah.
Try that. Get the laser ready. Oh, give it to me then. Give me the grabber. Laser on. Amazing, huh? Just doesn't look that impressive. But it's a little monster. Huh? What is it? Cotton candy, yeah. Scar tissue. Look at the scar tissue. I mean, that's not normal. You know, when I first saw the disc, when I first saw 5-1, I just thought, there's a little tear, there's a little bulge, it's not that bad, maybe it's not causing problems. We'll check it. Sure enough. Pain out of proportion to what it looks like on the MRI and CAT scan. It's really a CAT scan. I think that's what we had was a CT. No, MRI. Eventually we got our own MRI here. But just did not expect. So just a few more minutes, we should be done. It literally takes just a minute or two to put a bandage. Some steri strips, a bandage, and we're done. So I know it won't take you long to recover him.
Got the tolerance.
Hmm?
He's got quite the tolerance. 1,000 milligrams of diptone.
What is it?
1,000 milligrams of diptone. He's got
Really? Why is that?
You have to do genetics.
Should I be charging more money?
He's, 200 is what you use for general anesthesia, generally taking it down.
To put somebody down, but to maintain them. I mean, we've been in here a pretty fair amount of time. But you still feel that it's more unusual.
Normal for this duration would be about 400.
400?
Yep.
So he's more than double.
And he took Sildenafil, hydralazine, ketamine.
I don't know why we're having so much trouble with the cable. I can't roll it. Luis, I'm having trouble rolling the cable.
The laser fiber or
Yeah.
the cable?
The laser fiber.
So that way, yeah, one. So it's better for me. This better?
Yeah. Yep. Stand by. Give me the grabber.
I stand by.
Fuck no. This is the new one, the one that you just got refurbished, you
The
said?
one that we sent it, yeah. So
And
it's like a-
that wasn't an issue before?
No. No, that's
Interesting.
yeah.
I wonder what they did.
I mean, the quality of the vision is good, but now you can.
Yeah, I can't. I have to be able to put the grabbers in.
I send it back.
Well, just ask them first before you send it back.
Yes, sir.
The first thing you have to do is test those grabbers through the other endoscope. Make sure they go in. Then test it on this one. Make sure it doesn't go in. Right? Once you confirm there's a problem, then you call them and say, what do you guys do to the inner bore of this endoscope? Because I can't get our grabber down it. And those grabbers are designed to go down the endoscope.
My friend, I'm just about done.
Yeah, another minute. We're done. You're doing great. You alright? Huh?
Your shoulder.
Alright, we're gonna let you move your shoulder in about a couple of minutes. You guys ready to put the bandage on? Just want to finish this right here. And you guys can put the bandage on. So it looks a lot worse to me right here looking at this than it did on the MRI. Your L5S1 disc, I'm looking at it and it looks worse right now to me endoscopically than it looks like on your MRI. There's it just shows you one of the fallacies or weaknesses of the MRI diagnostically. It's not a great tool to determine the source of pain. Yeah, sorry about that. My God. Everything's going really well for you. Make sure you take it easy when you're recovering, okay?
Right.
Don't do too much. Just take it easy. Don't lift anything heavy. Don't be bending over, picking things up.
Oh,
Let your back heal.
right. Well, we're coming
Huh?
into a lull in front of me.
Okay. Remind me what you farm.
Seed corn for pioneer.
Sweet corn?
Seed.
Oh, seed corn. Okay, cool.
The good news is they got your blood pressure much better.
Uh,
The way you started.
Good. Thank you, doctor.
You did great. You did great. The blood pressure was a little bit out of control. I've been checking some of those medicines and see if
Yeah, I got a
not working great.
appointment this summer with my cardiologist.
Oh, good. Yeah, you're not working great for you.
Yeah,
Gotta give you some other stuff to,
yeah, I agree with you. Oh,
You okay?
yeah, it's just a little weird.
Yeah, we're right in that last bad disc.
In my
Just-
shoulder, my shoulder feels hard.
Okay. You're gonna let you stretch your shoulder out just a second.
Oh. I'll see you tomorrow morning.
Good. All right.
Oh,
It's amazing. None of this is normal. None of it.
what
And
else?
your L5S1, I mean, it looks so good on the MRI, and yet once I get inside, it's all scarred up from chronic inflammation.
Oh,
So it's no wonder why it was bothering you.
okay.
Just surprising, that's all. I don't see it that often.
Right, right. Well, that's fibromyalgia, chronic inflammation.
Yeah, you could be right. A lot of inflammation. Can't get this thing to rotate. There we go.
Hmm. Well, I have a girlfriend, or a fiance,
congratulations.
from the island of Mauritius.
Marusha, that's,
Stuck on a cruise ship right now.
oh God.
No, that's not good.
Standby laser?
And the song comes to mind.
Let me just get this last thing right here. Laser.
Fellow. I'm all alone and I need you to.
So how long is she stuck for, okay?
Huh?
How long is she stuck for?
August 29th, they're flying her home to me. And I gotta get her there.
Yeah, that's right.
Really worried.
I don't know. They just, there's crazy things going on. Heard there was a bomb went off today in Lebanon.
Really?
Yeah, it killed some people.
These people are idiots, aren't they?
Yeah, oh, did you hear about the 22-year-old policewoman the other day?
Oh,
Yeah, she was stopping somebody for a
That's on me.
traffic. A guy rides up on a bike, not related at all.
Thank you.
Shoots her 3 times and kills her.
oh no.
22 years old, beautiful girl.
Oh no.
Oh yeah, I'm not kidding.
Ow,
We're done. I apologize.
Uh-huh.
No problem, we're done. We
I
just,
was standing, I might, ow.
all right, I'm just putting a little pressure. That's just me pushing.
If I was standing, I might deck you.
Well, can I tell you my name?
Yeah.
It's Sam.
You're the big dude, but I'm gonna tell you something, Sam. I was a wrestler in high school, and I know how to bring you down.
I believe it, I believe it. I'm the handsome Middle Eastern looking guy in the room.
Tough sport. We had
Yeah, you got it.
Dan Gable came in my head.
All right. All right, you did good. We're all done. All right. Good work, everybody. Luis, let's get the room turned over. Okay, well, thanks for watching. Surgery went well. It was a bit longer than I expected, but there was more scar tissue than I thought. And Honestly, the inside of the discs were worse than they look like on the MRI. That's why you really can't rely on the MRI. You got to pay attention to the patient. Patient's having a lot of pain and it's axial. They have some bulging discs. That's probably the cause. Don't overlook those causes because you can fix them, make the patient happy. I'm going to go check on our first patient.